from Henry Ford Jackson Vascular Services, Interim Medical Director, Dr. Paul Corcoran. Welcome back to the show.
Thank you. Thanks for having me. It's a pleasure, and congratulations on your 5,000 show.
Well, thanks so much. And you've been here several times, but it's been a while since you've...
It's been a minute.
Yeah. So you're back in a new role. What is your current role with Henry Ford Jackson Vascular Services?
So I've come back as part of Henry Ford Medical Group, and we are revamping and revitalizing the vascular surgery service. And I've been tasked with that role of building a strategic vision and recruiting. And so I started in January, and I'm happy to be back. It's good to be home.
Well, it's great for the community because, as we've talked about several times, the need for vascular services, screening, and care is pretty high here in Jackson.
Yeah.
So what will this do to increase access to vascular care?
So, first and foremost, have access for clinic appointments, to be able to see patients, to be able to get out in the community, educate our population on vascular disease, the importance of screenings, as you and I have talked about in the past, and to build up the scope of surgical services that we offer, new technologies, new procedures. And I'm excited to say we've recruited a new surgeon, Dr. Miles Jackson, who's just finished his fellowship in Toledo. He's starting at the beginning of March, and he's going to bring a wonderful skill set to the community, and we're interviewing a couple more folks, so we're rebuilding fast.
Awesome.
I think that's going to be great for the community.
So Dr. Jackson coming to Jackson.
Yes, sir.
It's a natural.
That's a natural fit.
Oh, we should probably identify, or define what vascular services. What is the specialty?
Yeah, a lot of people don't know. I get asked when I tell people what I do. They go, "Oh, you operate on the heart?" And no, I don't. That's cardiac surgery. But basically, I just tell patients every blood vessel outside the brain and the heart, arteries and veins, and diseases of arteries and veins are our primary focus. That's our training, and that's what we do every day.
And it really can affect so many issues in literally every part of the body.
Sure.
It's also an indication of someone's health by having vascular screening. I remember at one point we were assessing patients' stroke risk through vascular
through screening.
Yeah.
Absolutely. And, just like other diseases, early diagnosis, so doing a screening and finding out you may have something allows us to initiate treatment earlier and maybe prevent complications like strokes, heart attacks, ruptured aneurysms, for example. So our screenings focus on finding those things that can be silent but life-threatening.
So what types of treatment options are there that will be part of vascular care?
So we have a lot. I think the wonderful thing is, our toolbox is pretty full. So we offer minimally invasive procedures. I think the wonderful thing that's happened over the course of my career, starting when I finished fellowship in 2006, is just the change in technology, the minimally invasive nature of our specialty, patients having much quicker recoveries, getting out of the hospital faster, most of the time in a day or two. But yet we retain that capability of doing that traditional operation, which sometimes patients need. And so we'll be able to offer the full scope of procedures. But I think patients need to know that we've come so far that very often our treatments are minimally invasive, less painful, fast recovery, and they should not be afraid to come in for a screening. Because I've had patients say that in the past. They were afraid to come in because they didn't know what it would lead to. So it's good for them to know that. Yeah,
I just read an article last week. There's a supposed expert on health that said, well, when I get to be 75, I'm not going to do any screenings. I don't want any health updates. I don't want to have any kind of physicals because I don't want to know.
Right.
And it was surprising because this was somebody that's supposedly an expert.
I have to question that.
Yeah.
No. I think we spend a lot of time. A big part of our practice is helping people maintain their function, maintain their quality of life. And as we get older, that's important. So if we can prevent a stroke, if we can help someone function better, walk better, and just maintain a good quality of life, that's important, and that's a big part of what we do. So early diagnosis, early treatment, let's help people live a long, healthy, happy life free of complications.
So stents, balloons, those kinds of things, that's part of what you do?
Stents, balloons. We can treat some very difficult problems with stents and balloons and what we call stent grafts, things that can be done from within the arteries. in a very minimally invasive way.
So you've got patients that say, I've put off coming in because I don't want to know. But are there some signs that people should be on the lookout for that would indicate they've got something that needs to be seen?
Yeah, there can be. One common thing we see is people having trouble walking as far as they want to. They may be walking a certain distance. They can usually tell me I can walk to my mailbox or I can walk to a certain house, and by the time they get there, their legs are very painful. Their calves are tightening up. That's something we call claudication, meaning they might have poor circulation in their legs. So that's one common problem that we treat. Other things, though, can be silent. So some people might have what we call a mini stroke, a brief event, lasts for a couple hours, and that can be a precursor to something bigger. So people shouldn't ignore changes in their vision, changes in their speech, even sudden changes in one side of their body to the other, such as numbness or weakness. Sometimes, my mom's of a generation that doesn't complain, and she had a similar episode and ignored it for half the day until I called her on the way home. And so you just, if something's going on, call your doctor, go to the emergency room, get checked out.
Now, some of those things sound like they just might be the natural aging process.
Could be.
Is it typical that you would have issues as you're older?
It could be, yeah. Certainly there are changes that occur, but we also know that there are subtle things that can be ongoing that you may not catch. So that annual physical with your doctor is important, and the screenings are important. Because we used to think, for example, that diseases of the neck arteries might not play a role in our decline in mental capacity, in other words, dementia and things of that nature. But we're starting to learn that it might. And so, again, early treatment can help us preserve function.
So minimally invasive treatments, what about the screening process? I hear people say, I don't want to go into any kind of a scanner. What kinds of things do you do to screen for that?
Yeah, so a couple things. So a simple ultrasound. So nothing but a little surface ultrasound. We can check the arteries in the neck. We can check the main aorta, the aneurysm in the stomach. We're looking for an aneurysm or an enlarged blood vessel. And then we just do some simple pressure measurements in the ankles and toes. And that can be a good indicator as to whether or not there's any artery disease. And then what we do with that information, that's the patients. We give it to them. If there's anything critical, we'll call their primary care doctor and inform them. But that gets them on the road to treatment, and it allows us to get them on the right path.
Are there some things that we can do to improve our vascular health?
Exercise is number one. Walking. We encourage at least 30 minutes of walking a day. Proper diet. Not smoking is a big one. For our diabetic patients, of course, working with their doctor to try and control their blood sugar as best they can. Those are all important things. Blood pressure is another important thing. Cholesterol. Being on the right medications and being compliant with medications is important. So that's the other big thing that's changed over my career, is that the medical management of what causes the diseases we treat has gotten so much better that the risks of adverse events in patients is going down just with the medical management alone. So working with your primary care doctor, routine physicals is very important.
Yeah, and it's along the lines of what healthcare is doing now. It's a partnership with the patient where the patient has to take on some responsibility for their...
No, I tell patients, if we're going this way and you're still smoking, you're going that way, we're tugging in a tug of war. So, one of the things we know with smoking, for example, is if someone is still smoking and, let's say we do an angioplasty or a stent and we help improve the blood flow in their leg, the life expectancy of that intervention goes way down. So I tell patients what we do is like putting tires on a car. Everything has a certain amount of mileage. Nothing's forever. And so for the patient to maximize their outcome, they've got to be going in the same direction. They've got to be changing certain behaviors in order to get the best long-term success.
How often should someone have a vascular screen?
So I think a one-time screening is appropriate. So it depends too on their family history. So for example, if someone has a family history of an aortic aneurysm, we recommend a screening at age 50. In someone who has risk factors such as high blood pressure, diabetes, high cholesterol, or a family history of heart and vascular disease, I think a one-time screening is perfectly appropriate. And then from there, just routine follow-up with their primary care doctor.
So it's something that could be running in the family?
Could, absolutely, yeah. And we generally see that, I've had some folks that have come to me at a very young age, and they've had a very strong, in their 30s, for example, with a very strong family history of heart attacks and strokes. So it can be a very strong factor in some families.
It's just the way your genetics.
Yeah, it's the genetics. It can be genetics. Like some people have cholesterol, high cholesterol, that's very difficult to treat. It's genetic and can be a real challenge. So for some folks, it's almost they do everything right and they still unfortunately have issues, and it's the underlying genetics of it.
So you've got Dr. Miles Jackson coming in from Toledo, and you're planning on continuing to build that?
Yeah, we're excited. We have an interview coming up on the 3rd with a very exciting candidate from Illinois, whose wife happens to be a cardiologist, and so we're excited to bring them both for interviews, and we have some other candidates that we're working with. So I think we will be back up to full staff very shortly. And it's been a very rewarding process to get some exciting young candidates that want to be a part of the community come to the hospital and offer their services.
Yeah, and that'd be neat if you get a twofer.
Yeah, right. No, it's almost meant to be, because we've got probably some impending retirements from some of our senior cardiologists, and so it just so happens that, and it turns out the gentleman we're interviewing, his wife knows Dr. Jackson's wife because she's also a cardiologist. so it's a small world.
Awesome.
Yeah.
Well, we appreciate you coming in today. Thanks for being part of our 5,000 show, Paul.
Thanks for having me. It's exciting. And I wonder what show number I was a part of in the past, but it's exciting to be here for 5,000.
I think Trish can look it up and let you know.
Yeah, and I don't know how I missed the Glumpies in the green room. I don't know if I did or not, but those look good.
They went fast.
Yeah, they apparently.
The interim medical director for Henry Ford Jackson Vascular Services, Dr. Paul Corcoran. Well, we've